So, without further ado, our first presentation is going to be presented by Jody Jollimore. He is presenting Furthering HIM's Reach, Sexual Adventurism and Substance Use. Jody Jollimore is the Senior Program Manager at Health Initiative for Men, where he oversees harm reduction and knowledge exchange programs. He is the chair of HIM's Research and Evaluation Committee, where he represents the organization as a co-investigator on several CIHR and PHAC-funded studies. Jody did his BA at Concordia University in Montreal and his master's in public policy at SFU in Vancouver.
So for those of you who attended this morning's session on positive deviance and group sex, there'll be a couple of slides that you'll recognize from the earlier session. I apologize, but because of the topic, there will be some repetition. Of course, those of you who did attend both sessions, you now get the advantage of seeing me on the main stage, and that's where I prefer to be quite honest. Not that room 1510 wasn't delightful, but I much prefer it up here. So I did start with a bit of a caveat this morning around my use of the word gay. So I use the word gay because that's how I identify. I identify as a gay man, and I have for a while. Sometimes I call myself fag because I'm very comfortable with that language. I recognize that not everyone is, and certainly as an organization, Health Initiative for Men recognizes that not everyone is. So some people prefer to not gay identify at all. Some people might go with an MSM label. I haven't met a lot. But some guys identify as queer or bi or trans, and we offer services for all of those guys. So just to be clear, for the presentation and simplicity's sake, I'm going to talk about gay men, but I really mean a much broader definition. So this is the mission of HIM, and I always begin every presentation with the mission of HIM because I think it's good to return to why we're doing the work we're doing and also frame it for you so you understand what it is that we're trying to achieve as an organization. So this is a long mission, but really there are three important parts. So the first one is that we offer trusted, tailored, targeted health promotion. The second one is community engagement. We highly value community engagement. And the third is we like to foster mutually beneficial relationships between healthcare providers and gay men. While our programs usually have an element of all these things, today I'm going to focus on the health promotion aspect. So here are a few of our different health promotion, either ads or posters that we've circulated. As you can see, at HIM, we believe in 4 areas of health. So physical, sexual, mental, and social health. And we recognize the relationship that each of these play on these. We think it's important to strengthen men's physical health as well as their mental and sexual health because we know that there's a relationship between those 3 things. We know that guys that feel better about themselves, that are more confident, are more likely to make healthier choices. And we want to support that. And that is a really simplified way of using the theoretical language determinants of health, which if you haven't heard at this conference, you may have heard many other times with gay men's health work. And also that we consider the syndemic nature of gay men's health. So that really is the relationship of various intersections. So in 2012, using STOP HIV dollars, we conducted a community consultation. And once again, gay men really stepped up to participate in this. We're always amazed at the amount of men that come out to participate, to share intimate details of their lives with us, because they want to make a change. They want to see things get better. They recognize that things have gotten better in their life, and they want to contribute to that. So the report was titled, Recognizing the Needs of Diverse Communities. We interviewed 208 men. They represented 20 agencies. More than 850 online surveys were completed, and that was really just in the Vancouver coastal area. So what did it tell us? So in truth, nothing that we didn't already know. But sometimes you need to consult to know what you already know or to confirm what you already know. The guys we talked to overwhelmingly said that the internet was important, that providing more options for information, options for prevention tools, for healthcare providers, highly important to them. They want us to branch out of the West End. We needed to engage more cultural communities, younger men, sexually adventurous men, men who use drugs. And while I'm not talking about this group today, physicians. We also need to engage physicians, and that's really a cultural competency piece for another presentation. So in 2013, we got to work from the findings of our community consultation, and we relaunched checkemout.ca, our flagship site, and we made it a more functional, user-friendly, and more importantly, better-looking site. Now guys can book appointments, they can engage in chat with healthcare providers, they can view our calendar, access our tools in a more modern way. An organization that understands the power of the internet must put their money where their mouth is and develop a good site. If we really believe that that's where guys are, that that's where they're meeting, and that's where interventions need to happen, then we can't have outdated sites to do this work. Engaging diverse communities. So while we were building the site, we were also working on other aspects of the consultation. We started to look for ways to expand our reach, engage the unengaged. I'm proud to say that HIM now offers services in Fraser Health, meaning we have 4 testing locations, so the Davie Street location, Drive, New West, and Surrey. We also launched a series of smaller consultations in order to better understand those prioritized communities. So if you attended a session this morning with David Portese, you would have heard about the Fraser Health consultation. If you attended a session with Michael Quagg, you would have heard about our Chinese and Punjabi consultations. We also did one on substance use by an MPH student, Peter Hong, and we co-facilitated a consultation on group sex with the Positive Deviance Project. And then we started to offer programming. Again, we don't just want to consult, we want to use this information and put it into practice. So I said from pig sex to dirty talk. So in 2010, there was a workshop that was offered at this summit, and it was called Pig Sex, and it was a workshop that was being offered in Toronto by the guys at ACT. And it was a successful workshop to create a safe space where guys could talk about the things that were important to their sex lives. When I heard about this, and I heard they were presenting at this summit, I asked them if they would be willing to do a session for us here in Vancouver. But because we're Vancouver, we wanted to raise the stakes a little bit. So instead of doing it at a local gay bar, we took it to Steamworks Bathhouse to create an even sort of more safe space where a lot of those activities might go on. And what we found from pig sex was a real desire for men to speak about these things. We had over 20 guys come out, I actually think we had over 25 guys come out to the pig sex workshop, and we divided them into smaller groups and put them in rooms, and each group, their conversations took different themes. So one group talked about safety almost the entire time, like how they protected themselves, how they were negotiating STIs and condom use. Another group didn't bring up condoms or safety once. They talked about pleasure and the joys associated with the kind of sex they were having, and the smells and the sweat, and very different themed. So, but all of these we thought were rich conversations and important to have, because we know that guys aren't having these conversations when they're in the moment. In the middle of a group sex party, somebody doesn't start talking about Hep C transmission. They might, but we don't think it's happening as often as maybe those conversations need to happen. So we want to create safe spaces where they can. I would say the group was successful. We had 6 to 12 participants each week. They ranged in age, cultural diversity, and experience. Some were novice, some were experts, some were voyeurs who just wanted to see what was going on and explore the bathhouse. I wanted to put this slide up because this is taken directly from ACT's description of their pig sex project. And really the important, and we took these principles and used them for dirty talk. But the important part for us was we want to nurture these protective factors by providing an environment where guys are affirmed and valued rather than judged. An environment to share risk reduction strategies for otherwise taboo topics. So that brings us to the high life. So we spent some time talking to the sex pigs, and we realized that a lot of pig sex and a lot of group sex involves substance use. And that brought us to this campaign that we launched in Pride of this year, a time when a lot of guys might be experimenting or not experimenting with substance use. And again, we recognize the role that substance use plays with mental health and with sexual behavior. And our consultation really allowed us to better focus on that. So there are a couple of different groups of drug users. Some are recreational users, others are problematic users, some guys fall somewhere in between. This campaign was really for the low-hanging fruit. The gay guy who might be just coming out, and that could be at any age, who wanted to know a bit more about drugs but doesn't know where to ask, wants to find out more than what his buddy can tell him at the club when they're partying, or what his drug dealer can tell him. And so we took a harm reduction approach with this tool, of course, and we partnered up with YouthCo because we wanted to take a youth focus with this campaign. It was a very successful collaboration. Here you see a couple of our tips. So I think, right, and here are a few more. So there were a few sections of the site. So you see, this is actually a handbill that's reversed. So if you found this in the club, one side would say party and play, and then the other side would give you a practical tip that you could use. Because we didn't want to rely on people going to the website. You can't always rely that people, just because you put out a poster or a pamphlet and put a website on it, it doesn't mean that gay guys are going to go to it. So we thought, even if they just see this one card and do nothing else with it, let's try to get a tip in their hand to take home. So the High Life had a website, which is checkthemout.ca/highlife, and this image here you see is the quiz. So the quiz had 4 questions. It asked, why do you use, what do you use, how often, and do you think it's problematic? And then based on those answers, it would create a profile for you. So if you had identified that you like to use GHB and alcohol, the first thing that would come up in your profile is a warning that says, be careful when you're mixing GHB and alcohol. Not do not mix G and alcohol, but be careful, here are the risks associated with it. If you go to the menu in the right corner, you'll see a list of drug info, tips, trade secrets, which was our way of sort of talking about some of the harm reduction or those indigenous prevention tactics that we wanted to share, and of course resources. So while this was a resource intended for, again, guys who are the low-hanging fruit or not problematic users, we did include resources for guys who felt that they had problematic use. Here's some dialogue that was created, and I captured this from our Facebook wall because I just think it's interesting to see how different opinions vary. So of course the first guy is like, well, if you're going to do drugs, at least know a bit about them, which is really him's perspective. And then you read the second guy, and he says, and by the way, I don't feel like I'm breaking confidentiality because if you write on someone's Facebook wall, it's a fairly public thing. So sorry about it, Ryan C. Rope. But he says it just promotes immorality. These drugs will only produce far deadlier outbreaks of disease. Now, do we rush to the website to delete that? Absolutely not. We want to create those dialogues. We want that engagement. We want to engage guys who think that way, as well as those who subscribe to our harm reduction model. The last one is boys will be boys and sneak smokes behind the barn, which I guess is a very colloquial saying for somebody who lives near a barn. But we launched this in Pride. We've had 8,000 views. 600 guys have completed the quiz, and we're getting about 500 views a week. Now, I'm going to talk about my fucking life next. So we took a break from the High Life after Pride. We promoted it for about a month, and then we took a bit of break on the promotion so that we could focus on My Fucking Life. Because parts of the My Fucking Life web series also address drug use, we knew that we would be able to hook back into the High Life later on in the series. You'll notice when the My Fucking Life promos end in a couple of weeks, if you're on cruising sites and whatnot, you'll start to see more promo around the High Life. Which brings us to, what have I done here now? It's not moving pages. Thanks. And that brings us to our latest social marketing initiative at Health Initiative for Men, and that was My Fucking Life. We launched this the 1st of September. It was a collaborative between the Health Initiative for Men and Pole Focus Film School. It was intended to be a multimedia campaign, a bit based on, if any of you remember, Vic Vancouver. Vic Vancouver was a cartoon that originated in Gateway, but when Health Initiative for Men opened, we moved to Health Initiative for Men, and Vic was intended to have, it was a weekly soap, intended to draw in an audience and unpack sexual health issues in an unassuming format. And Vic had its flaws. It was also extremely popular, and we were able to attract a very young crowd, and that helped to build Health Initiative for Men's services over time. But it had its flaws. It was a highly Caucasian. There were not enough people of color in it, and I would say there were not enough trans people, and we didn't really deal with all of those issues as well as we could as an organization now 5 years later, where we feel we're a bit more mature and ready to deal with those, and some of those things are unpacked in the My Fucking Life web series. So, PreProduction, our cast and crew, we had over 70 men in Vancouver involved in the creation of the series. We recruited one set of men to tell us their sexual adventures. So if you actually go to myfuckinglife.ca and you watch the episodes, you'll notice that there are voices and then there are people, and they're not the same person. We also recruited him volunteers to reenact those stories to create a level of anonymity so that we wanted guys to share their most intimate details with us. So we had to protect them from us exploiting them, and that's not really what we want to do as a health organization either. So we recruited local models, venues, we dealt with local issues. We had some cross-promotion with places like Steamworks, where we were able to go there and promote the series and also shoot at Steamworks, which is, when the community comes together, it means that a small budget can go a lot further. So we created 6 episodes, a movie romance, which was really the introductory episode, 4 or More, which was about sex parties and group sex. Sex in a Box, which is bathhouse culture. 3's Company, which is about poly and open relationships, Double Taboo, which is a PMP episode, and a numbers game. And so we started with stories, we distilled them down into these topics, and then they led to a number of subtopics. So even though we didn't intend to talk about HIV disclosure, it came out in 2 of the episodes and a lot of the guys' stories. We didn't intend to talk about hepatitis C. It came out as we were talking about group sex, mental health, addiction, recovery. These things, they grew naturally from the guys' stories. And I would say a significant component to the success of this, and it will continue to contribute to the success of My Fucking Life, is really the cross-promotion that we did. So again, this was based on Vic Vancouver and the number of cross-promotion we did there, but we went to social media. We almost exclusively promoted on social media through Twitter and Facebook and through our networks. We have a blog strategy to engage a number of gay bloggers around the country and around the world. We had a finder contest, which was an interactive way for the guys who participated in the project to go out to gay venues and take selfies with people, and that would get themselves invited to the wrap party. And all of these various hooks meant that when we actually had our wrap party, we had, I would say, 70 to 80 gay men there, maybe more, and a lot of unfamiliar faces, which to us was a success. It meant that we got people who weren't necessarily attending our groups or maybe not attending our clinics, but they came out to an event. And for us, that means that we can, again, hook them into all of the other integrated services and programs that we offer. If that was their first point of contact with Health Initiative for Men, it's my understanding most people had a pretty good time that night, so it will lead to better things. The keys to success, again, it was cross-promotion. The contest, we had media coverage with Extra, with Same blog in Australia. Positive Light is about to put out a piece, as is Homo Culture. You'll see here, these are some of the cross-promotions, these images. So the guys in their towels were at Bathhouse one night. These are the guys on stage at one of Carlotta's shows at the Junction. And the results so far, so we've had over 15,000 views. The least popular episodes, and I put these because I think it's kind of interesting to see where guys migrate, the least popular episodes were the substance use episode and the harm reduction episode, and I would argue those were the 2 more serious episodes that dealt with things like recovery and addiction. We saw an increase in our, I should mention the most popular episodes then, were group sex and the bathhouse episode. We saw an increase in our Facebook likes and traffic. We saw increased web traffic to checkthemout.ca. And I mentioned the wrap party, which you'll see we had a portable sling as our photo booth, which provided many men a lot of enjoyment that evening. And that's my presentation. Thanks, guys.